Are currently at levels of cases that are still above the highest level of our last surge. So we haven't even come down below the surge last summer. We continue to have 2,000 deaths a day. So this is not the level that we're in a good shape to just plateau at. We've got to push further downward. Pulling back on the restrictions at this point that have worked to make this, to get it start getting under control, it's too soon. I'd say the biggest opportunities are, I'm tracking every day what the numbers are, and the number of people who are in situations where they're with 10 or more people has climbed more than 30% over the last couple of weeks. So those are things that have to go, we have to bring that back under control.
And indoors, so much more dangerous than outdoors, which is so hard this time of year in most parts of the country. So given what you've just said, how then should governors and other officials in a position to make decisions, how should they decide about when to lift restrictions and how much?
Well, they're already opening up restaurants, bars, weddings all over the country. And at this point, you know, the most important things are really continuing to measure those restrictions and say, if I see that these levels are continuing to plateau and not going down, they've got a signal that those are going to have to roll back. If we see them going up, that's even more concerning. And we have the new strain circulating, including the New York strain, which has some of those elements of being more contagious and potentially being more resistant to some of our efforts, including vaccination. Those are ones we gotta continue to track and be ready to stop.
Doctor, one more thing. Studies show that in Pfizer and Moderna, one shot of the vaccine may be enough to protect those who've already had COVID. The CDC is currently debating this. What's your assessment?
I'd like to see the CDC get their evaluation out pretty quickly. I think the evidence is pretty solid that giving just a single shot to people who've reported that they've been infected before would be a smart thing to do and enable more vaccination to go to others as well.
Dr. Atul Gawande, as always, thanks very much. Shepard Smith here. Thanks for watching CNBC on YouTube.